Choosing whether to replace your declining hormones in your 40s or 50s is a big decision with major consequences. Avoiding the topic and not doing anything because of all the conflicting information and dismissive doctors is also a decision with major consequences. Not understanding the risks of hormone replacement therapy correctly is a serious risk to your long-term health. Knowing what's scientifically true about hormone replacement therapy and what's true for you in terms of your goals and the amount of biological resilience you want to have in your later decades can help you clarify your thinking and decide on a plan for yourself that you feel good about. You're listening to the Health Courage Collective podcast, episode 223, The Overlooked Risks of Hormone Replacement Therapy. Welcome to the Health Courage Collective podcast, the show for women who are too busy to slog through hours of generalized, inapplicable, and often contradictory health information, but too smart to ignore that a few minutes of focused attention now can prevent years of suffering in the future. I'm your host, Christina Hackett, a pharmacist who doesn't want you to live on prescriptions, a certified coach specifically trained to maximize your potential, and a compulsive learner obsessed with preventative, cutting-edge, holistic, and integrative medicine. I'm on a mission to increase your physical and mental resilience so you can fearlessly look forward to your next 40-plus limitless years. Your time is now. Let's go. Hey, welcome to today's episode. I hope you're having such a terrific day today. How have you been this past week? How is your thinking? How are your 3 questions? Did you use them to change your life yet, even in small ways? Remembering to ask yourself those questions throughout the day really does change the trajectory of your day and what you get out of it. Today, we're talking about the overlooked risks of hormone replacement therapy around the time of perimenopause and menopause. This is a topic very near and dear to my heart. If you are thinking about hormone replacement therapy or confused about it or just trying to figure out what you want to do, click the link in the show notes or come to my website, www.healthcouragecollective.com, or send me a message at healthcouragecollective@gmail.com and get on the waitlist for my beta program. We are going to get you a concrete plan that you love for how you want to move forward with your hormone health. What's worth it to you to pursue, the budget you're willing to spend, and the provider you're going to work with to get the hormonal care that you deserve as you get older and wiser. It's going to be a great time with an even better price tag. So let's get you clear about what you want to do. It feels so good once you finally make a decision and you're clear about what you want to do moving forward. So let's get you that clarity. Okay, so life is all about weighing risks versus rewards, especially in investing and in medicine. And nuisance alligator hotline report teams. That would be a crazy job. I would much rather be the telephone dispatcher than the girl that shows up in your backyard with a stick and some duct tape. Weighing the risks versus the benefits is a big thing for most decisions, especially medical decisions, like deciding whether to take hormone replacement therapy or not. It does have some risks, one very huge one, and almost everybody, especially medical providers, get them way wrong. So let's get them right so that you can live more as you get older rather than less. I heard a statistic that of eligible women in the United States, 4.7% of them were on hormone replacement therapy. That was in 2020, so 5 years ago. Maybe it's different now, maybe it's not. But why do you think that number is so low? Because for the past 25 years, we've been told that hormone replacement therapy is scary. Specifically, I think most doctors and women believe that hormone replacement therapy increases your risk for breast cancer, heart attacks, strokes, blood clots, and dementia. And that if anyone in your family has ever had breast cancer, you are not even a candidate for hormone treatment. Or that if you've ever had a blood clot or arrhythmia, it's off the table. The prevailing belief is that hormone replacement therapy is just for symptom suppression and it should be used at the lowest possible dose for the shortest possible duration, and that there is no reason for a woman over age 60 to be on hormone replacement. I think for those 95.3% of women, either they feel like the risks are not worth the benefits that they're told come from hormone replacement, which are symptom suppression, they can tough out the symptoms to protect the long-term health of their breasts, hearts, and brains. Or their medical providers are unwilling to have a conversation with them about it and just dismissed hormone replacement as risky. Probably because they don't understand the true risks themselves, or there was so much conflicting information about it that they just didn't want to go there. It is a lot of work. First, you have to figure out what's actually true. Then you have to decide what you want to do about it. Then, if you do want to pursue hormone replacement therapy, it's incredibly hard to find a good provider who is competent at understanding all the nuances and prescribing a regime that is personalized to you. The vast majority of doctors don't have a clue how to prescribe, monitor, and adjust hormone replacement therapy for midlife women, and they don't want anything to do with it. Of the few who are willing to prescribe, many of them are not competent enough to do it optimally. It's a wacky world that is materially harming women, and by extension, society at large, because society benefits from having strong women who have accumulated wisdom. Okay, so let's get into the overlooked risks of hormone replacement therapy. HRT does not cause breast cancer, heart attacks, or dementia. That is a fact. If you want some reputable resources about that, send me a message at healthcoachcollective@gmail.com, and I will point you in the direction of a whole host of good information that will explain in detail how we got that so wrong for so many years. Basically, the Women's Health Initiative trial taught us that giving a standardized dose of horse estrogen and a synthetic progestin orally to a group of metabolically unhealthy women with pre-existing conditions who have been hormone deprived for 10 years or more is not a good idea. But that data was interpreted extremely poorly, to put it mildly, which has harmed millions of women. Millions. It is true, however, that there are estrogen and progesterone receptor positive breast, uterine, endometrial, and ovarian cancers. Not because the hormones cause the cancer, they don't, but because after the cancer has slipped past the immune system and been able to get itself established, the hormones help feed the cancer. Usually certain metabolites of hormones that are not very prevalent in healthy women and that dock to certain receptors that get out of balance when you are unhealthy in some way. We talked about how you can change your estrogen receptor profile back in episode 162, Understanding Estrogen Receptors. The truth is that of all women who develop breast cancer, the ones who have been on bioidentical hormone replacement have less aggressive tumors, an easier treatment period, and better outcomes overall than those who haven't, because their cells are more resilient. If you yourself have had hormone-positive cancer in the past, you need a very specialized and highly educated provider to work with you if you want to use hormone replacement therapy. It can be done, but it takes lots of extra care. If you have active hormone-positive cancer right now, starting hormone replacement for the first time is probably not for you. What tons and tons of doctors and women get wrong, however, is that a family history of breast cancer is almost never relevant to whether you should start hormone replacement therapy yourself. If it's a sister or a mother who got breast cancer or another hormone-positive cancer before the age of 60, it should be carefully considered, especially if you have 2 or more relatives who have had early hormone-positive cancer. Then you might want to pass on exogenous hormones. But if your relative was over age 60 at the time of diagnosis, it really isn't that relevant. The vast majority of breast cancers are diagnosed in women post-menopause. If healthy young physiologic levels of hormones caused breast cancer, why are the vast majority of cancers developing after hormone levels have drastically dropped? Next up, let's talk about blood clots. Synthetic and horse estrogens and estrogens taken orally do increase the risk for blood clots, especially if you smoke. Premarin, birth control, Femring, but not Estring, possibly even oral estradiol tablets will increase your risk of blood clots. You shouldn't start taking hormone replacement therapy for the first time if you have an active deep vein thrombosis, pulmonary embolism, thrombophlebitis, or active Trousseau's sign or factor V Leidens right now. If you have a history of a blood clot that appeared during pregnancy, that's a sign that hormone replacement therapy might not be for you. If you have active or recent arterial thromboembolic disease like TIAs or strokes or heart attack, you probably shouldn't start HRT right now. If you have advanced atherosclerosis, meaning plaques in your arteries, cerebrovascular, cardiovascular, or peripheral vascular disease, severe hypertension, or uncontrolled cardiac arrhythmias, you probably shouldn't start hormones until you get those conditions resolved or optimally controlled, especially if you've been without hormones for a while, like if you went through menopause 6 years ago or something. Navigating hormone replacement in the presence of clotting disorders requires nuance and care, but a clotting risk for the vast majority of women without clotting disorders or active clots or severe disease is pretty much non-existent, especially if you use human identical estradiol and apply it topically or vaginally or possibly sublingually, but you'd have to be careful not to swallow it too soon if you did sublingual. You could also get a coagulation blood test to look at your fibrinogen or other clotting markers to see what's going on before you start hormones if you're worried. Basically, if you're using human estrogen and not taking it orally, the increased risk of blood clotting requires more research, but it's probably about 0. And maintaining physiologic levels of hormones prevents or drastically delays all of the scary cardiovascular events like heart attacks and strokes that are so common in women after menopause, whose hormone levels naturally fall off a cliff around age 52. But if you've been without hormones for a really long time and your receptors are downregulated and you have active cardiovascular disease and plaques in your arteries and those kind of things, starting hormones all of a sudden can increase your risk of plaque rupture or other cardiovascular events for the first year that you're on the hormones. So you have to be super careful. But starting hormones before those diseases get that far along prevents them from getting that far along. Another commonly extolled reason to not take hormone replacement therapy is if you're 60 years old or older, or 10 years past menopause or longer. I absolutely think that you should start your hormone replacement journey way earlier than you probably think you should. If you're a proactive go-getter and get tested and see that your hormones are declining, but you haven't started feeling many symptoms of hormone deprivation, you can essentially opt out of perimenopause. It's so much easier to gradually transition into replacing what your ovaries are no longer able to produce than to wait till you're in perimenopausal hell and try to fix a bunch of miserable problems. But if it's too late for that, that's okay too. Start as soon as you can. The sooner the better. Well, not like 22 years old or something, but you know what I mean. But if you or someone you know is 60 years old or 10 years past menopause or older, it's not necessarily too late. It's not the optimal time to start for sure, but you can't change the past. The longer you live in a state of hormone deprivation, the more downregulated your estrogen and progesterone and possibly testosterone receptors become. So starting hormones when you're 66 will not have the same effect on you as they would if you started when you were 46. You don't just need a supply of hormones, you need a supply of functional receptors and correct levels of sex hormone binding globulin and functional metabolic pathways to clear excess hormones safely. So it's more tricky and less effective at first, especially because the longer you spend deprived of hormones, the greater your risk of cancer, heart disease, dementia, muscle loss, bone loss, depressed mood, and overall physiologic resilience. So if those processes have started before you start your hormone replacement therapy, the effects are a little bit different. But being 60 years old is not a total non-starter. Most doctors, however, will say that it is. So the bad news is that it will be pretty hard to find a good one to work with. But the good news is that when you find one, they'll probably be someone who knows what they're doing. Actually, I take that back. You still have to be super careful not to be working with someone who's too cavalier about starting everyone on hormones no matter what, but isn't competent enough to understand the nuances of starting after a period of prolonged deprivation. The other part of this is that it's pretty generally accepted that because hormones are only appropriate for symptom suppression, you should stop taking them when you're 60. This is humongously wrong, in my opinion. We talked about this a lot in episode 219, 10 Common Mistakes with HRT. Go back and listen to that one if you missed it. It basically all boils down to what you believe the benefit of hormone replacement therapy is. Maintaining the hormone levels you had in your 30s, ideally with the naturally cycling up and down estrogen and progesterone on different days of the month, is not for suppressing hot flashes or memory lapses. It's extremely effective for that, but that's not the only reason to take hormones. They prevent or drastically delay all of the common diseases of aging. All of the biological risks that drastically increase after menopause, like atherosclerosis, heart attack, stroke, dementia, all kinds of cancer, especially colon cancer, muscle loss, bone loss, depressed mood, impaired thinking, metabolic dysfunction, even frozen shoulder and plantar fasciitis, are all reduced when younger hormone levels stay present. It's up to you to decide what you believe and what you want to do. But if you're using hormones as the most powerful anti-aging therapy there is, then why would you want to stop it just because you turned 60? If you're biologically and holistically doing great, turning 60 is not a reason to stop. And it's not a magic number at which hormone replacement suddenly becomes dangerous. So those are the most common arguments against HRT that I think you'll hear, especially from medical providers. I hope you understand them a little better now and are confident advocating for yourself. There might be some other issues that come up as you explore your options, including things I haven't thought of, but here's a quick list of some other risks with hormone replacement. Pregnancy. Seems kind of obvious, but it is a contraindication. An unstable uterus. What the heck is that? I don't really know, but basically if you have unexplained vaginal bleeding, abnormal ovarian cysts, adenomyosis, unexplained pelvic pain, PCOS, or uterine fibroids, those issues need to be properly dealt with before blindly adding hormones to the mix. If you have active liver disease or liver dysfunction, hormones may not be the best thing for you. If you're on seizure medications, adding hormone replacement therapy might affect the levels of those medications, which could affect your risk of having a seizure. So caution is needed and dose adjustment of the seizure meds might be needed. Lastly, most autoimmune diseases effects are improved with properly done hormone replacement therapy protocols. The one exception is systemic lupus erythematosus. You can work with a competent provider if you don't have active disease, but if you do, hormone replacement therapy can increase lupus flares. Okay, so those are risks that are maybe misunderstood, but should not be overlooked. Let's move on to the truly overlooked risks. A risk that I think is extremely overlooked by almost everyone is your health status when starting hormone replacement therapy. If you are not a healthy host for the addition of hormones, you will have very different effects than if you are. This is rarely talked about. I'm sure you can tell that I'm pretty pro-hormone, and I think 100% of eligible women should be given proper knowledge and the opportunity to replace their hormones if they want to. And if they understand it all and they don't want to, that's totally fine. But as much as I sing their praises, hormones' effects will not be as beneficial if you are not a healthy receptacle for them. If you are constantly exposed to a lot of environmental toxins and endocrine disruptors, your hormones are going to go down very different pathways, the same way the hormones produced by your ovaries before you turn 40 do. If you have chronic inflammation, high insulin levels, high blood sugar, high stress, low resilience, a leaky gut, a disturbed microbiome, IBS, GERD, use lots of drugs, including proton pump inhibitors, then hormones will not do as much for you as they otherwise could. And they could potentially go down some more dangerous pathways. So as close to a magic pill as I believe hormones are, though I hope you remember by now that you don't want to take them as a pill, doing the basics to be healthy hosts for those hormones is way more important than the addition of the hormones themselves. They cannot work their magic amongst cells that are struggling. An important thing to know that you can find out with a Dutch complete test is how you metabolize your estrogen. The 2-hydroxyestrone detox pathway is healthy, stable, and anti-carcinogenic. The 16-hydroxyestrone and 4-hydroxyestrone pathways are problematic. So knowing your body is sending your estrogen down that pathway is super valuable because it gives you time to make the lifestyle changes you need before you start pouring more estrogen into that system. If you metabolize estrogens via 16-hydroxyestrone and 4-hydroxyestrone, you're much more likely to feed an estrogen receptor positive cancer. So even though I'm all about using hormone replacement as a powerful way to prevent all of the chronic diseases of aging and starting early, it's more important that you optimize your daily habits first, even if that delays your starting hormones for a little while, especially if you need to fix your metabolic pathways first. Getting your metabolism, like your insulin levels, mitochondria, alpha and beta estrogen receptor ratio, and estrogen metabolism pathways in check first is essential for a good outcome from hormone replacement therapy. I think that transdermal, meaning through the skin, delivery of hormones via creams or a patch is best for most women. You can also get systemic levels of hormones by placing them vaginally. Some providers do everything sublingually, that's like dissolved under your tongue. Theoretically, that's fine, but the patients have to be very careful to not swallow their spit too soon, or it's essentially an oral dose. If you use a cream, which is super common and I think it's great, you just need to be sure you are aware of the risk of transferring your hormones to your loved ones. Rubbing your cream on the inside of your forearm is great for dosing, but if you then put your arm around your grandson before school every day, or you hold your dog or something, that can be a problem. Even if you rub your hormones somewhere else, like your inner thigh or upper arm where it's covered by a sleeve, if you don't wash your hands afterward and then you go hold someone's hand or go to jiu-jitsu class or something, you could potentially dose them with some hormones. That's a risk, to be sure, but a super easy one to avoid and fix as long as you're aware of it and vigilant to wash your hands. Also be aware that for women who are more than 50 pounds overweight, sometimes topical hormones have a little bit more trouble getting to where they need to go, so adjustments may need to be made to get optimal effect. Everyone is unique. Okay, we're almost done. We're to the biggest overlooked risk of hormone replacement therapy, in my opinion. I think every doctor in every specialty there is, well, except for maybe pediatrics or men's health, should be taught to fear this risk of hormone therapy. If providers really understood this threat and feared it as much as not ordering every possible diagnostic test, diverging from the standard of care, not following the guidelines, getting on an insurance company's bad side, the world would be a very different place. There is a clear and present danger in regard to hormone replacement therapy. Every provider should be asking themselves this in regards to their female patients ages over, let's say, 47. What are the risks of not putting her on hormone replacement therapy? The question is usually framed as, who are the women who should be put on hormones? And the answer is usually women who have unbearable symptoms of estrogen loss. But the better question, the question that does the most good for women and for society at large, is who shouldn't be put on hormone replacement? The answer to that is the few women with the conditions we've already discussed, or those who just aren't interested. The vast majority of women are candidates for hormone replacement if they want it, and the risks of not taking advantage of it can be catastrophic. Increased risk of depression, foggy thinking, retiring earlier than wished because of perceived loss of mental sharpness, anxiety, Alzheimer's disease leading to a complete loss of self and requiring skilled care, fatigue leading to loss of productivity, muscle loss leading to frailty and loss of independence, bone loss leading to an excruciating and often fatal fracture, cancer, especially colon cancer, decreased survivability of cancer if it does occur, impaired ability to repair damaged DNA, atherosclerosis and unfavorable cholesterol levels leading to heart attacks, strokes leading to loss of independence, frequent urinary tract infections leading to a messed up microbiome from antibiotic use and possibly sepsis, a messed up microbiome in general, urinary incontinence leading to a limited life, vaginal dryness leading to general discomfort and also pain with sex, decreased libido, decreased sexual enjoyment, impaired glucose control leading to a vastly increased risk of all of the chronic diseases of aging, weight gain, hair dryness and color loss, sagging skin, more fat and bone volume loss in the face, dental problems, frozen shoulder, plantar fasciitis, poor immune system function leading to both increased susceptibility to infectious diseases and increased risk of autoimmune conditions, impaired sleep leading to fatigue and increased risk of weight gain and all of the chronic diseases of aging, generally higher chronic inflammation, which increases the speed of aging and adds to chronic pain, and probably some other stuff I forgot about. Wow, that might be the world's longest run-on sentence. Oh wait, I forgot hot flashes. That belongs on the list too. The biggest risk by far is not replacing eligible women's hormones. We talked about this in episode 218. Why is it so hard to find a good hormone doctor? But the vast majority of prescribers are not comfortable even talking about menopause, let alone prescribing hormone replacement therapy to women. And many of them believe they could be sued and their malpractice insurance wouldn't cover them if they did prescribe it. I don't know if that's true. It might be, and it's crazy. We know from Dr. Rachel Rubin that Medicare would save about $22 billion a year if all menopausal women were given vaginal estrogen. That's just the cost savings of cutting all postmenopausal women's risk of UTI in half, which vaginal estrogen has been proven to do. Imagine the economic result of perimenopausal women who didn't have to miss work because of unbearable symptoms, of cutting all women's cardiovascular disease burden down to the same level of that of premenopausal women, which is low, or making it so equal numbers of women and men get dementia. Right now, twice as many women get Alzheimer's compared to men. Of reducing both infectious diseases and autoimmune diseases among women, of reducing chronic pain and increasing independence among women, of drastically cutting the risk for falls and osteoporotic bone fractures. The list goes on and on. Not only is a population of healthy women economically valuable to everyone, well, except the drug and medical device companies who treat all of these conditions, it's good for society. Wise women who feel good enough to engage in society, mentor the upcoming generation, and fight for what matters to them, improve life for everyone in the community. Kids need grandmas and great-grandmas. Mothers need their mothers. Corporations need senior leadership. Governments need wisdom, experience, and level-headed non-reactivity. I think the biggest and most overlooked risk of hormone replacement therapy is not deploying it to prevent, lessen, or drastically delay all of the chronic diseases of aging that are currently causing women to stop living before they die. Thank you so much for listening today. If you found this episode helpful, please share it with a friend who could benefit from understanding the real risks of HRT. Let's all help each other along the way. If you're interested in this topic but still a little lost about what hormone strategy is best for you or how to get started, come to my website, www.healthcoachcollective.com, or click the link in the show notes and get on the waitlist for my beta program. We'll be getting you clear about your hormone replacement therapy options and helping you decide exactly what you want to do for yourself and how you're going to execute moving forward to make it happen and get the care you deserve, but is really hard to find. Get on the waitlist or send me a message at healthcoachcollective@gmail.com. Next week, we're going to talk about making change less hard. Until then, be one of the smartest people you know by understanding the real risks of hormone replacement therapy, and don't be normal. Thank you so much for tuning into the Health Courage Collective podcast. I am truly honored that you have paid me the enormous compliment of your time and attention. I would be so grateful if you would share this podcast with someone you know and subscribe so you never miss an episode. This podcast is for entertainment and information purposes only. Statements and views on this podcast are not medical advice. This podcast, including Christina Hackett and producers, disclaim responsibility for any possible adverse events by use of information contained herein. If you think you have a medical problem, consult a licensed physician.